I'm Jennifer McGee, and I'm one of the nursing faculty here. I teach the senior nursing students, the nursing 230 students, and they are the lucky group that gets to do the presentation today. This is kind of part of their leadership management portion of their coursework to learn how to work with the community, and they're doing a presentation on Ebola. Well, we've been following Ebola before it even became the media frenzy, because part of the course study this semester is on infections, the infection process, and the immune system. So we've been following it pretty closely, and so I gave them the opportunity just to put all that information they were giving me every day about Ebola into practice. So they're going to try to give you some information to kind of inform you of what's going on with Ebola. So if you're feeling a little bit edgy today, it's all about Ebola. So I give you the Nursing 230 class.
Hi, everybody. Thank you for coming this afternoon. We sure appreciate it, even if you maybe had to be here. We sure appreciate you being here. We sure appreciate being here in your red and white. I'm Amy Wool, the president of our class. This is Kim McGovern and Kara Clark. And our concentration, our concentration in our group was defining what Ebola is, its symptoms that we would see, how can it lead to death if it's not diagnosed early enough or not treated, and how is it transmitted, so we can go out to our communities, friends and family, and possibly leave here today and inform them more. While we're overhearing national television, us nursing students don't get a lot of time sometimes to watch TV anymore. We don't know what's going on in the world, so hopefully we help you with that today too. While you're on a Facebook feed and you're looking through the news, you can't quit from hearing it on the radio on the way to campus. You can't quit from seeing the word Ebola. So what is Ebola? It's a virus. So we'll back up there. What's a virus? A virus is a small infectious agent that can only multiply and replicate in living things only, so in the cellular level. So Ebola is a virus. When the virus enters our body, it likes to just relax for a little bit, set up shop, like it's decorating a new house. You move to a new house, you might put curtains here, you're not really doing much, you're just kind of putting stuff until you get real settled in. That's called the incubation period. So when the virus comes into our body, kind of just hanging out, chilling, relaxing, before it goes full-blown and we start seeing outward signs or just don't really feel good, we know something's wrong with our body. That's the incubation period. So Ebola, the concept of incubation also occurs with the Ebola virus. The incubation period of the Ebola virus can be as short as 2 days and as long as 21 days. So for up to 21 days, you can have the virus in you. You just don't see any outward signs that show to us or the healthcare providers that something definitely is wrong. On average, of what we've seen so far, the signs and symptoms have been anywhere up to 4 to 6 days where we've seen this, from the onset of the virus to 4 to 6 days later when we've been seeing them in an infected body. Symptoms of Ebola can include, get ready, fever, fatigue, joint pain, muscle pain, headache, nausea, vomiting, reddened eyes, diarrhea, loss of appetite, stomach pain, sore throat, rash, cough, hiccups, chest pain, breathing problems, and difficulty swallowing. And as though all of that isn't enough to deal with as the patient or possibly the healthcare providers to try to conquer, there's one great big symptom of this, and that's the hemorrhagic symptom. That can simply be called, we'll call it bleeding for today, bleeding. Now this isn't the type of bleeding where you're preparing real quick your peanut butter and jelly and you slice your finger open. We can expect there's probably a big possibility with a steak knife that you're going to bleed. This is the type of bleeding that we cannot understand where it's coming from. Why? There's no explanation why we are bleeding with this virus. It could be internally or even external type bleeding. So, bleeding like from the eyes, from the nose, from the mouth, from the ears. Internal bleeding that eventually may get outward, such as bloody diarrhea, bleeding in the vomit, even the skin seeping blood we've seen. Death due to the infection of the Ebola virus is typically seen about 2 weeks of symptoms. And the reason why the victims have been dying is from this massive unexplainable blood loss.
Okay, I'm going to talk a little bit about the transmission. Because the natural reservoir host of Ebola virus has not yet been identified, the way in which the virus first appears in a human at the start of an outbreak is still unknown. However, scientists believe that the first patient became infected through a contact with an infected animal, such as a fruit bat or a primate, which are apes and monkeys. The Center for Disease Control will call that a spillover event. Person-to-person transmission follows and can lead to large numbers of people being infected. In some past Ebola outbreaks, the primates were also affected by Ebola, and multiple spillover events occur when people touched or even ate the primates. When an infection does occur in humans, the virus can spread in several ways. It can be spread through direct contact through broken skin or mucous membranes, such as the eyes, the nose, or the mouth, with blood or body fluids, including urine, saliva, feces, vomit, breast milk, and even semen. Through a person who is sick with Ebola, and also it can be spread through objects such as needles and syringes that have been contaminated with the virus, or through infected foods such as the bushmeat, and through fruit bats and primates. It is not spread through the air or by water or in legal food purchased in the U.S. However, in Africa, it may be spread as a result of handling bushmeat, which are the wild animals that they hunt over there for food, in contact with the infected bats. There's no evidence that mosquitoes or other insects will transmit this virus. Only a few species of animals, which I've already mentioned, humans, bats, monkeys, and apes, have shown the ability to become infected with this virus. So, for instance, it is spread through direct contact, but you must have a break in that skin. So, if I touch Kim just with her clothing, we're not going to get the virus. But if she has a cut and she touches a counter, you may be infected. Or you sneeze and you don't on the counter and you don't clean it up, you have the possibility of contracting that virus. Healthcare providers caring for Ebola patients and their family and friends in close contact with these patients are at highest risk of getting sick because they may come in contact with infected blood or body fluids. During outbreaks of Ebola, it can spread very quickly within the healthcare setting. Exposure to Ebola can occur in healthcare settings where hospital staff does not wear the appropriate protective equipment, PPE, such as masks, gowns, gloves, and eye protection. Dedicated medical equipment, preferably disposable kind, which we use in the hospital, should be used by healthcare personnel providing patient care. Proper cleaning and disposal of these instruments, such as needles and syringes, is also very important. If instruments are not disposable, they must be sterilized before using them again. Without sterilizing these instruments, the virus transmission will continue and amplify and cause an outbreak. If you suspect a member of your household or you with symptoms, it is recommended to use a bleach-based cleanser to clean all surface areas, clothing, or other objects that have affected or come into contact with the person's body fluids. The CDC states to use a EPA, which is Environmental Protection Agency, registered disinfectant that will kill these certain viruses, and most of these EPA disinfectants are found in the hospitals. Ebola that is on dry surfaces like doorknobs can survive for just a few hours, but body fluids, the virus can survive at room temperature for several days. Once someone recovers from Ebola, they can spread the virus. However, they cannot spread the virus. However, it has been found in semen for up to 3 months. Absence from sex, including oral sex, is recommended for at least 3 months. However, if you're unable to do that, you need to use condoms to prevent the disease from spreading.
As of right now, there are several countries with widespread transmission, particularly in West Africa. Those include Guinea, Liberia, and Sierra Leone, and that is the entire country that is affected. We have several countries that have some cases of Ebola, but not widespread transmission. Mali has 3 known cases of Ebola, those being in the Kayes region, Spain has 4 known cases, which are in the Madrid region. And the United States, as we know, has 5 known cases of Ebola around Dallas, Texas, and New York City. As of right now, Nigeria and Senegal have been declared Ebola-free. As you can see, this is a map of Africa. There are several countries that have been affected by the Ebola virus. Some range for as little as 1 case, all the way to greater than 300 cases. Ebola has been a situation since 1976. It became more popular and seeing more outbreaks around 2000 all the way to now. You can see those outbreaks in Uganda, the Philippines, the Republic of the Congo, West Africa, and now in the United States. We'll start by September 30th is when the first known case of Ebola was in the United States. That was Mr. Duncan at Texas Presbyterian Hospital. He passed away on October the 8th. October 10th, the first nurse, Mrs. Pham, at Texas Presbyterian Hospital, who provided care to Mr. Duncan, tested positive for Ebola. Ms. Pham has now recovered and has been discharged from the National Institutes of Health, and that was on October the 24th. On October 15th, the second nurse, Mrs. Venison, at Texas Presbyterian Hospital, tested positive for Ebola, and she is receiving care at Emory University, and that is in Atlanta, Georgia. On October 17th and the 20th was when the World Health Organization declared Senegal and Nigeria both Ebola-free. On the 23rd, Mali reported its first case of Ebola in a child who had traveled from Guinea. The child, however, passed away on October the 24th. And on October 23rd is when the New York City Department of Mental Hygiene reported a case of Ebola in Dr. Craig Spencer, who had returned from Guinea where he was serving with the Doctors Without Borders program. He is in stable condition at this time. And this is a map showing Guinea, Sierra Leone, and Liberia. And if you look to the western ocean coast, you can see there are few hospitals, so it's very hard for them to seek health care when they have Ebola. So therefore, you have widespread disease transmission.
Okay, risk for exposure. So the CDC categorizes everybody at some risk. You guys are probably no identifiable risk, but they've got high risk, some risk, low risk, and no identifiable risk. And depending on what category risk you're in, depends on what protocol they follow or they have you follow. Okay, so for the sake of this presentation, we're going to focus mostly on high risk. So high risk includes actual contact with your patient or with a person with Ebola, with their body fluids, contact with the deceased, any type of physical contact with them. If you're within 3 feet of somebody who is symptomatic, that makes you high risk. Okay, so symptomatic and asymptomatic. Symptomatic means you're showing signs. You've got a fever. You might have the rash. Asymptomatic means you don't have any symptoms. You don't have a fever. You don't have a cough. You're not nauseous. You don't have the bloody diarrhea. So this is how they decide the CDC decides what they're going to do with you depending on your symptoms. So if you are high risk, or even if you're not high risk, but if you are symptomatic, they rapidly isolate you with immediate contact of public health authorities to arrange for safe transport to an appropriate health care facility. So medical evaluation is required, of course. Isolation orders may be used to ensure compliance. Air travel is permitted only by medical transport. They're not going to put you on an airliner in Evansville and fly you to Emory. They're just not, unless it's medical transport. So, let's see. Healthcare workers are at the highest risk, really, when you're caring for your patients with Ebola. This includes direct patient contact, doctors, nurses, physician's assistants, and other healthcare staff, as well as ambulance personnel, burial team members and morticians, like I said. And direct active monitoring. Direct active monitoring is what they do if you have been exposed directly to the patient, but you're not showing symptoms, you're asymptomatic. So they ask that for up to 21 days, well, they tell you that for 21 days you're going to be quarantined in your home or in a healthcare facility, and the local public health authority, they assume complete responsibility of you. That public health officer comes to you. They check your temperature, they assess you for signs and symptoms every day for 21 days. Usually, well, they state you'll have 2 visits. The first visit, they do come to you. The second visit of the day can be a telephone call. It just depends on if you're not starting to feel well or something, whether or not they decide to actually come to you that second time, but it's for 21 days. So, and then active monitoring is if you've potentially been exposed to somebody with Ebola. So, and that is also for 21 days, but they ask that you don't quarantine yourself, but that you take your temperature for 21 days, you assess yourself for signs and symptoms. They give you the opportunity so it's not such an invasion, but they still assume liability for it. The do not board policy. At the request of CDC's Division of Global Migration and Quarantine, persons who have a communicable disease constituting a public health threat, in addition to meeting specified criteria, may be placed on the do not board list and issued a border lookout enforced by the TSA, Transportation Security Administration, and Customs and Border Protection. So basically, if you are a public health threat, like you're under direct active monitoring and they tell you to stay in your house and you decide you're not going to do that, they might put you on a do not board list. So you go to an airport, they've got you on this list and they're not going to let you on the airplane. Quarantine stations. There are 20 quarantine stations. It's part of a comprehensive system that serves to limit the introduction and spread of contagious diseases in the United States. Located at 20 ports of entry and land border crossings where international travelers arrive. Most of these quarantine stations, you can tell, are on the coast, except for Chicago and Minneapolis and maybe Detroit. So they're all international airports, or where you would expect international travelers to be. The CDC has the legal authority to detain any persons who may have an infectious disease that is specified by executive order to be quarantinable. If necessary, CDC can deny ill persons with these diseases entry to the United States. CDC also can have them admitted to a hospital or confined to a home for a certain amount of time to prevent the spread of disease. These are the guidelines currently for international travelers. If you're not an American citizen, that's your warning. They can tell you that you can't come. Okay.
Good afternoon. My name is Beth, and I have Carrie and Courtney, my classmates, and we research diagnosis and treatment of Ebola.
Okay, so in the early stages of Ebola, it's difficult to diagnose it because early symptoms include fever, fatigue, muscle aches, kind of the same thing that we see a lot with the flu or other disease or viruses. So there are specific diagnostic tests that they can do to determine a positive or a negative result. ELISA testing, when your body's exposed to a harmful substance, you develop antibodies which your body uses to fight that substance off. So this test can detect and measure antibodies present in the blood and determine if they're related to a specific disease process. With your PCR testing, this determines the viral load of the virus in your body, and this is the definitive test for Ebola. The immunohistochemistry can detect virus in tissue samples from the deceased patients with Ebola. And IgM and IgG antibodies is a blood test that can detect specific antigens in the blood. And they can also do virus isolation, which can prove presence and viability, and it uses in vitro cell culture to determine this.
Okay, so how do we treat this virus? Well, we all know, or the nursing students here know, that you can't treat viruses. There's no cure for viruses. You can only treat symptoms of viruses. So according to the CDC, there is no FDA-approved vaccinations or medications available for Ebola. Now, currently there is some experimental vaccines and treatments being under clinical trials and under development, but as of now, none of them's been FDA-approved for their safety or their effectiveness. So we're going to talk about supportive care. The symptoms are treated as they appear, and as we know with Ebola, you are not contagious until you show symptoms. So as soon as you get symptoms is when they're going to start. They're going to put you in isolation, and they're going to start to begin your treatment of your symptoms. And the sooner you seek treatment, the better the outcome it is for Ebola. For example, we'll take Mr. Duncan, who we taught was the first one in the United States to die from Ebola. He had symptoms for 4 days at home. He went to the doctor and went to the hospital. They sent him home and told him he had the flu. Well, 1 to 2 days later, he came back with severe symptoms. At that point, his body was already crashed. There was no way of recovering from that. Some of the treatment that you would give patients with Ebola is going to give them IV fluids. You're going to replace the fluids that were lost through vomiting, diarrhea, blood transfusions to replace the blood loss. We're going to assess and maintain the electrolyte status of the patients, replenish the potassium, magnesium, sodium, whatever may have been lost through the vomiting, diarrhea. You want to maintain their oxygen status, keep that up, make sure the blood pressure is staying up, and also you're going to watch for other infections that may occur also and treat those as they arise. Recovery from Ebola depends on when you seek treatment, where you seek treatment, the capability of the hospital to treat Ebola, and also on your body's immune response. If you have, good immune response, or, it just kind of depends on your body if your body fights it off. People who do recover from Ebola develop antibodies that will protect them from the Ebola virus for, they say up to 10 years, maybe longer. It's still unknown at this time if the people who do recover from Ebola, if they're immune for life, or if they can be infected with another strain of Ebola. All that we'll be able to tell more as time goes on. And same with long-term complications. Some have been reported of joint pain and vision problems, but this is kind of going on right now, so we'll know more in the future, more of long-term complications.
All right, this is our last group, and we're going to be talking about guidelines and preventions for Ebola. I'm Kimberly, and this is Tamara, Melissa, Nick, and Tasha. And I want to start out, I'm going to pass this around. I'm going to give this to the people here. And this is the local hospital Ebola screening that they're doing right now. And what that is a screening process. So if you go into your local hospital, any of the doctor's offices, urgent cares, you're going to be asked these questions, and you'll be asked 1 or 2. If both of them are positive, that you've had these symptoms, and you've been in contact with someone who has traveled to the Africa, where this is being at right now, or have had some direct exposure, then they're going to put you in isolation, and it kind of goes on from that. But I just want you all to be aware that it is going on here locally at our hospital and our facilities. And so, and then I'm going to start with Melissa? Tamara.
Okay. Okay, I'm sure everybody is mostly concerned with the risk for exposure. So the CDC has come up with a few guidelines to help the public prevent the exposure to the virus. And we have just addressed this during the presentation. But just to recap, as any virus, our skin is the #1 defense. We should know this. And so for proper hand hygiene, we're going to use soap and water if our hands are visibly soiled. If not, CDC has approved that we can use alcohol-based hand sanitizers. We also do not want to handle any blood or body fluids from anybody that's been exposed with Ebola, and that's including clothing, medical equipment, bedding, anything like that. We do not want to be handling those things. However, we have discussed that you cannot get this just by close contact. If you have a casual conversation like I'm having with you today, you're not going to contract Ebola even if I had it right now. Another thing that they have discussed is avoiding funerals and any burial rituals where you would be touching the deceased body as someone who had Ebola. We want to avoid eating any raw meats from bats, any non-human primates such as monkeys or apes, and you also want to avoid handling any raw meats from those animals. And Shelby had listed a few of the hospitals earlier of where West Africa, where the people are being treated. We want to avoid those areas. I'm sure that seems like common sense, but do not go there. That's where they're treating the outbreaks. Stay clear of those areas. And then if you were to return from an area like that and you were to feel that you had been exposed, or here in the United States, if you feel someone may have some symptoms, the diarrhea, the coughing, the nausea, not feeling well, you want to kind of not really isolate, but just monitor, do the active monitoring twice daily for any temperatures, any symptoms like that. And if you do have the symptoms, you want to call your healthcare provider so they can let you know how you need to be treated.
Okay, the instruction that is up on the screen now is one of many that you can find on the CDC website right now. This one is showing you how to properly remove your personal protective equipment. They have another one on the website as well that will tell you how to properly put on your PPE. So healthcare workers who may be exposed to people with Ebola should follow these steps. You want to make sure that you wear appropriate personal protective equipment, and we're going to demonstrate some appropriate PPE towards the end of the presentation. Make sure that you practice proper infection control and sterilization measures per hospital policy. Your hospital will be able to tell you what those policies are and should include immediately cleaning contaminated surfaces with an EPA-regulated disinfectant wipe. You want to isolate Ebola patients from your healthy patients. That's going to include a private room with a private restroom and making sure that you keep all doors shut. You want to avoid direct contact with the bodies of people who have died from Ebola. The virus may still be active on their body. Notify health officials if you feel you have come into contact with blood or bodily fluids. It may be a scary time. You might be afraid of what they're going to do, but just remember, you don't want to put your family's health at risk or anybody else in the public at risk. Use dedicated equipment on the infected individual and dispose of the materials as recommended by hospital policy. This is going to include equipment such as stethoscopes, blood pressure cuffs, linens, and just anything that you use in that room. You want to conduct environmental surface cleaning per CDC guidelines, such as whenever you're cleaning out a room after an Ebola patient. Disposal guidelines are outlined by the CDC, but they are also regulated by procedures from your local, state, and federal regulations. Cleaning and disposable methods may include the EPA registered wipes that we discussed, an autoclave, which is a pressurized machine using steam to sterilize, or it could be incineration or burning of the materials. You want to make sure that you're performing frequent hand hygiene. This is going to include using soap and warm water or alcohol-based scrubs anytime you get ready to enter a room or after you have come into contact with a patient with Ebola. If you feel that you have been exposed, you want to immediately stop working. You want to wash your skin with soap and warm water. You want to irrigate with copious amounts of water for your eyes, and immediately contact your occupational health supervisor so they can implement access to post-exposure management services. The appropriate PPE, workers have to be thoroughly trained in donning and doffing PPE, which means they have to be trained on how to put on the PPE and how to properly remove it without contaminating their skin. The CDC now recommends completely covering the body from head to toe, and there should be no skin showing. We have brought in a guest speaker. His name is Chris Belcher. He is the captain and EMS coordinator for the Owensboro Fire Department. He is going to be coming in with two of our classmates, Nick and Tasha, who will be wearing proper PPE, and I'm going to see if they are ready at this time. So, Tasha and Nick, and as I've already said, this is Chris Belcher with the Owensboro Fire Department. Chris, can you explain a little bit about what they
Yes. What we have is the Owensboro Fire Department, we were actually very lucky that we were already prepared for Ebola and we didn't even know it. We had, through the fire department, we don't just fight fires and go to car accidents, we also go to medical emergencies too. And unfortunately, some of those times, it's things we deal with are bed bugs, decomposed bodies, people who don't live very sanitary or healthy lifestyles. So we had this ensemble already available to us, and with the H1N1 virus that was out and it was enforced a couple of years ago, we were already carrying the N95 mask as well. So we were better off than what we thought. But what we didn't have was some of the questioning and stuff that was involved as far as our dispatch, getting the information just like they said, find out what the symptoms are and have they traveled. So we got that worked out with our dispatch, and we started coordinating, working with public health and things like that, and we developed this ensemble. So we already had it, so we didn't know it, so we just started piecing it together. So this is your bare minimum level protection right here, the N95 respirator, face protection, everything is going to be covered. Another thing we're doing is we're double gloving too. The problem with that is they have to decontaminate themselves. They talk about bleach solution. That's where we use a 10-to-1 bleach solution. And we take a garden sprayer and they have to spray themselves down. They have to wait a few minutes. Then they have to start very carefully taking everything off. And that's where we knew decon because we're in the hazmat business. But being very particular, if anybody saw what Dr. Sanjay Gupta on CNN did, he put chocolate sauce on his hands and started taking it off. Well, he ended up with it on his neck, on his arms, just like you would if you had blood or bodily fluids, other potentially infectious materials. So we had to come up with a system to start taking everything off very systematically and very carefully and very deliberate, just like we do in hazmat. This is a level A hazmat suit. All else fails, this is what we can resort to. This is what we use for any time we have an unidentified chemical, the unknown, worst case scenario level protection. It's completely encapsulated. She has a self-contained breathing apparatus on as well, has chemical-resistant gloves, and she is totally encapsulated. This is a very confining suit, though, very confining. So we felt comfortable, and CDC, they guaranteed this, because this thing, you all know, this was a very fluid process, wasn't it? Learning all this stuff, and we're learning stuff new every day, too. So this is worst-case scenario, this is the bare minimum. Keeps shaking her pass device inside there, so if a firefighter was down for 30 seconds or longer, the pass device goes off. That's what that beeping is. So she has to keep shaking it.
Thanks for explaining that.
Okay, so that's the end of the presentation. Does anybody have any questions they'd like to ask us regarding Ebola? If not, that's great. We're good with that. We just want to thank everybody for coming out. Thank you to the Nursing 230 class for participating. Thank you for Mrs. McGee for allowing us to do this presentation. It was a very interesting process, and we've learned a lot through it. We want to thank Chris Belcher for coming out on his day off and explaining a little bit of the PPE with us. And thank you all for coming out.